The NHS Long Term Plan is designed to move forward over a 10-year period so that we have a health service fit for the future. The plan aims to give everyone the best start in life and to help people age well. Patients will be better supported and have care that is conveniently and effectively joined up. Some of the key areas of focus of the long-term plan include improving outcomes for major disease such as heart disease, stroke and dementia, providing better access to mental health services and enhancing out-of-hospital care that supplies both primary care and community health services. The NHS People Plan seeks to address the workforce challenges that the NHS services are facing, not only to increase the workforce, but to offer better support and development to improve staff retention and make the NHS the best place to work. Allied health professionals make up 1/3 of the clinical workforce. They're described as significant and play a huge part in supporting the demands of the NHS and delivering the aims of the long-term plan. Allied health professionals can ensure the sustainability of future services by using their expertise to bridge the gap between primary care and community health services by supporting and contributing to improvement plans. By understanding the aims of the long-term plan and the role that allied health professionals play in its delivery, we can be better equipped to assist and support the transformation of a world-class health service that our nation deserves. Here are some of the responses given by students on why they felt it was important to understand the aims of the long-term plan.
I think it's important for students to be aware of the NHS long-term plan because ultimately it should be guiding our practice, whether that's through future first contact physio roles, through the discharge process in the acute setting or out in the community. As healthcare students, we're the future clinicians, managers, educators and leaders of the NHS, so it's up to us to be delivering the long-term plan.
Hiya, I'm Sarah, third year physio student at the University of Brighton. I believe that students play a huge role in the delivery of the NHS Long Term Plan. I think that since we're now getting the opportunity to have training on a lot of different things like mental health training, we're getting a lot of training on conditions like dementia, which of course are one of the few of the main targets in the long-term plan. I think if we use our knowledge and skills to work towards those, it will be quite helpful. I think it's important for all students to know what's going on in the long-term plan, just so we can always have it in the back of our heads that we're aiming towards these goals. And I think that since all the goals are quite clinically reachable, I think if all the students help out as much as they can, it will take the pressure off all the already qualified staff who are aiming towards these targets.
I believe moving forwards, it's important for students to understand the aims and objectives of the NHS long-term plan, because the majority of healthcare students will at some point in their career be working within the NHS. By understanding the aims and goals of the plans, these students can bring a fresh perspective into the plan and might be able to come up with new and innovative ways of achieving it. Also, by understanding what the overall plan is, they can help work towards the end goals.
I think that as students, it's so important for us to know what the long-term plan is and to educate ourselves on it, because we are the future clinicians. We need to be able to know what's going on, so it's not a surprise when you start working and then all these changes are occurring. So it's really important that we educate ourselves on it right now. Why do you think it's important healthcare students know the aims of the plan? Yeah, it's really important because you are the future workforce. You are going to be implementing a lot of the stuff that they're trying to do right now. So it's important that you give yourself the best opportunity, the best step forward, so it's not like a struggle to implement. It'll be a lot smoother if you are understanding of what is going on.
As a physiotherapy student, I do value the NHS Long Term Plan. It's helpful to know that we're all working towards a mutual goal, and that current trends in epidemiology have been acted on by the NHS. It affects me as a patient, as a student and as a future employee of the NHS. So, for example, what areas of physiotherapy are going to be most in demand over the coming years. It's also really important to understand as a student, so when we go out on placement, we can understand and be sensitive to the demands that are put on our colleagues.
I think it's really important for students to understand the aims of the NHS Long Term Plan, from how it might affect the work that we do as future professionals to how we can be active in helping to deliver it. Right from the start of our careers, we'll have the opportunity to campaign, influence and shape healthcare provision in light of the NHS plan, so we can all help to ensure that physiotherapy remains a core part of the future of the NHS.
I think students and new graduates undeniably will have a massive role in contributing to and delivering the NHS Long Term Plan, especially when they'll hopefully remain part of the NHS for a long time themselves. I also think it's incredibly important that allied health professional students know the aims of the plan so they fully understand it, and how they can alter their practice to ensure they're working towards the aims at the present as well as meeting them in the future.
As students and the future workforce of our NHS, take some time to understand the long-term plan and where you fit into the progress of it. To meet the aims of the long-term plan, we need to work together as a team in both primary care settings and community service settings and contribute to making our NHS great for both staff and our populations.